Welcome to another great episode of All in Wellness. Today we have a very special guest with us, Dr. Kate D. Today we're going to talk a little bit about neurotoxins for those patients who are new to Botox or other neurotoxins and how those may work really well for you. Whether you're looking to enhance your physical health, nurture your mental resilience, or simply find a moment of peace in your day, you're in the right place. Let's embark on this journey together, embracing all the possibilities that wellness has to offer. Dr. Kate, welcome.
Thank you so much for having me today.
You're so welcome. It's great to have you. And Dr. D is the author of the aesthetics industry exposé, Medspa Mayhem, and she is the founder of Glow Medispa, where she performs all aspects of medical aesthetics, from injectables and skincare to laser and body sculpting. She is a graduate of Yale. She earned a BS in biology in 1989 and her MD there in 1994. In addition to her medical practice, Dr. D has a special interest in business ethics and the medicolegal aspects of practicing aesthetic medicine. Without further ado, welcome. How are you today? It's so great to have you on.
Thanks so much for having me. I'm great. It's a beautiful day here in Seattle. I understand it's completely a blizzard where you are, so
it is, unfortunately. We thought winter was going to escape us, but it's here. We just have to make the best of it, right?
Yeah.
So let's talk a little bit more about what is your true passion and how did you get started?
I've learned as I've gotten older, I kind of have a lot of passions, but my interest in aesthetics dates back over a decade now. I used to do breast cancer work, and I was a radiologist in a breast center, and I did a lot of imaging and image-guided procedures like breast biopsies and stuff, and kind of fell into aesthetics somewhere around 2013-ish. And I had friends who had been doing it for a long time in their practice, and they encouraged me to check it out. And the very first day of the first training course I went to was all on laser physics, and I just loved it, and I love lasers, and then got into the injectables, and that was kind of right up my alley because it's a lot of needle procedures and talking to women all day, but you get to make people happy, which is not something I got to do back in breast cancer land. So it's pretty phenomenal to be able to do that. But in the decade that I've owned my practice in aesthetics, I've been kind of astounded at how many people are cutting corners and doing crazy things that are really dangerous. And I even think that a lot of those people don't even know how dangerous those things are because they're not medically trained at all. So I started writing a book and I got super passionate about getting that published. So that was published in June of 24. And yeah, and I've just been, talking about like the great things and also the scary things that we encounter in aesthetics. And yeah, that's what I'm hoping to do is kind of educate people. It's really, I mean, the byline is, it's the good, the bad, and the ugly. And there's so much good that we do. So I don't want to drown that out. Like there's more good than bad, but the bad is really scary. And so that's why I just want people to understand, what they're getting into and how to figure out how to pick the right provider and pick the right treatment so that they get only the good stuff.
And just doing their research, right? And asking the right questions. And definitely I feel like going in for the initial consultation is very important to get educated.
Yeah. I mean, think about like if you're going for, I don't know, let's say you're going to have a hysterectomy or have your eyelids done or something. Wouldn't you want to know that a real honest to God surgeon was going to do that treatment? Someone who knew all about that, right?
And was a specialist in what they do.
And was a specialist, knew what they were doing. I mean, the problem is like people put up a shingle and offer these treatments and aesthetics, and many of them have no medical training or, they're not allowed to practice medicine, but they're doing it anyway. And I just think that people don't really know how crazy that is.
It's really unfortunate. And there's so many adverse things that could happen if they're not properly trained and educated and what to avoid. And it's a medical procedure, so it's very important, right, to not cut corners. And it's really also, I think, important for any new patients, right, to ask the right questions of, how were they trained? How were they trained? And just talk about their training itself and, how they got started and how long they've been doing it and just get a little more of the history as well. With that said, let's talk a little bit about our favorite neurotoxins. Botox obviously was the original that was integrated in for migraines, but then 2002 it was FDA approved for cosmetic injecting.
Yes. And so Botox is kind of like Kleenex. It's the first brand people, knew, and And so a lot of times people will use the word Botox when they're talking about just any neurotoxin that's used for wrinkles. But there are actually 5 neurotoxins that are FDA approved in the United States. So Botox was the first one, and then Dysport and Xeomin, and then more recently in the last couple of years, Daxi and Juvo. And those are in use all over the country. In my clinic, we just use Botox and Dysport, but I have to say that we probably are about maybe 75 to 80% Dysport.
We are as well. That's definitely our go-to. It's our favorite product. I'd love to touch a little bit more about that. I work with Galderma, who works with us, at our clinic, and they talked about 5 years ago, they did a dream case study, and they found that 95% of patients were confident in their results. 96% looked refreshed, and they noticed the results lasting up to 6 months. So they're looking at doing like 2 treatments a year, which is similar to what we get with Daxify, and with a 3-day onset. Do you find that like the 3 to 5 day onset is nice as well?
Yeah. So I think that Dysport really stands out in the onset's quicker than Botox. So it tends to be 3 to 5 days, whereas Botox is, 1 to 2 weeks. And then we have found that Dysport lasts longer than Botox as well. We usually tell people 4 months. I don't really think most people get 6 months out of Dysport, but some do. Some do.
Right. It's a rare case, but it's nice if they do. They're not running back in for their treatment between the 3 to 4 month, but right before the 4 month window.
Sure.
I feel like what's nice is that the results are lasting and we're not chasing the line so much. And if they come in before it's totally worn off, they just get a better result and it's more natural looking.
For sure. So we've had both, but we will often have patients try both, and almost everybody thinks that Dysport sets in quicker and lasts longer. So that's why most of our patients choose Dysport. We actually charge the same. Not everybody charges the same for them.
Yeah, we do too. One thing we like is there's about 2% of the population that, I don't know if you found, that become resistant to Botox, maybe if they've been doing it for many years. And Dysport tends to be our go-to, our last resort. If someone is resistant, we've always been successful with them responding well.
Yeah, I think we've seen, so I would say we see fewer than 1 to 2% for either product. And the few cases that we see, we might see a couple a year, really. Most of those, none of the neurotoxins work anymore.
Right.
So it's like, it's a really interesting dilemma because, the way the neurotoxins work is that they go into I'm going to simplify this, but basically they go into the cell and bind to a protein inside the cell and permanently block transmission of a signal at that particular connection between the nerve and the muscle. Okay. And that's a permanent effect. That little connection kind of recedes, and then your body over time slowly grows new connections. And that's how the movement regrows, basically. And if you inject it and it doesn't work at all, that means your body's clearing it. It's not even having the effect, right? So you probably have antibodies against it. And Botox and Dysport, and actually all 5 of them, have the same active ingredient. There are 2 protein subunits that are stuck together, and that's what is the neurotoxin. And actually, Xeomin is just that with nothing else. Whereas Botox is those 2 little protein subunits with a big protein coat around it. And then Dysport's in between. Dysport has the 2 protein subunits and a smaller protein coat. But when you dissolve the saline in it, so they all come as a powder. You put in saline and it dissolves and it becomes like a clear liquid. That protein coat floats away, and that's just hanging out. That's not doing anything. But there is this theory maybe that, you can develop antibodies to the protein coat and maybe not to the 2 protein subunits. But in that case, really, they should still work, but they tend to not work. So my experience has not been great trying to keep using it. Like sometimes if one doesn't work, maybe the other one continues to work, but I don't believe that that's really a true antibody then, But either way, it's kind of a drag. I mean, basically, once it doesn't work, you're probably not going to be able to succeed with a different toxin. It's possible, but It's probably not likely.
And it's hard when that happens to the patient. There's nothing we can really do. And
it's a drag. You have to do other things.
You do?
For your skin, yeah.
Into talking about the benefits of collagen and biostimulators. And particularly, there's two products, Sculptra and Radius. And I think you and I talked, we both love to use Sculptra and the benefits.
I do love Sculptra. So, I think one of the key things for prevention is making sure you maintain your collagen. And so you have collagen inside your skin in the dermis, so like in the middle, the big thicker layer inside your skin, and that keeps your skin thick and springy. And then you also have collagen and also little fat pads, other things underneath your skin, immediately underneath your skin, that gives you the volume that we associate with youth and a youthful look, right? Mm-hmm. And maintaining that collagen is super important. Like preventing it going away is super important. So there's two big things that I do for that. One is inside the skin, we do a lot of RF microneedling treatments, which I don't know if you wanted to talk about today, but
no,
I find like that is like super important to maintain your skin so that it doesn't get thinned out and droopy. And I'm guessing I'm a big chunk older than you. I'm 57. And that's the main thing that I do for me. But that is really important to prevent that laxity, right? Maintaining the collagen and the infrastructure underneath your skin, it kind of makes you, kind of plumper, not chubby exactly, but like give you the volume that you have. Like when you're a kid, we have all these little fat pads that make us kind of nice and round or oval. And then we lose that and you start to look more scooped out, right? Mm-hmm. What the biostimulators can do, so collagen and hyperdilute Radius, and I'm not a big Radius fan, so I don't use it, but Sculptra. So Sculptra is made out of something called PLLA, polylactic acid. And that's the same material that's used in dissolvable sutures. It's actually been used in medical treatments for like decades, right? But in a powdered form, if you take those little particles and spread them around, what they do is stimulate collagen wherever you place it. And it's really great for cheeks, the nasolabials, the marionettes. And it's a very, very natural look. So it's this kind of, it does give you a little bit of lift and support and then also volume, and it looks great. And it's very long lasting because you're stimulating your own collagen. So your body breaks down collagen at 1% to 2% per year. Mm-hmm. And the thing is that, past age 30, the cells in your skin that make collagen don't make anymore. So you got to wake them up. That's why the RF microneedling, that's important. Mm-hmm. But then, if you can maintain your collagen kind of in and under your skin as you get older, then that really prevents a ton of what we see as aging, so the kind of being more hollowed out and droopy, it really, really helps with that. So, and Sculptra is just so easy because it really, very little discomfort with that. It's kind of mixed up with water and some anesthetics, so you really can't feel it. And it doesn't, it's pretty easy to do the procedure. It's easy on the patient. And then it's really long lasting because it's building your natural collagen. And again, like whatever collagen you get out of it, that'll slowly break down over time. But, that's only 1% to 2% per year. So it just lasts a really long time. And also, the formation of the collagen can happen over 1 to 2 years. So if you do, say, a series of 2 or 3 or maybe even 4 treatments, then that keeps getting better and better and better over the next year to 2 years, which is kind of amazing. Because with other treatments for volume, like with filler, in a year, that's pretty much gone, right? Mm-hmm. So it's really effective and natural looking and also very long lasting. So,
and I find we administer, and patients may not know this. It may sound, like you said, it's not painful, but we administer it down to the bone because we lose bone as well. And that's where we get that hollowing or that sagging or like under the eyes, especially, right? And that's why we love to interject the laser RF microneedling as well as the laser genesis to stimulate that collagen production. And they do receive a better result, don't you find, and just longer lasting?
Yeah. So we will often do, we don't have laser genesis. We have, in my spa, we have RF microneedling with a device called Genius, and then also laser resurfacing with LaserMD, it's called. And we often will combine those in a series so that it's, kind of basically a non-surgical facelift. Right. Mm-hmm. There's a device that I don't have, but a friend of mine has that is interesting to me because the Potenza is very similar to Genius, but it has a tip, and I haven't seen it, so I haven't demoed this on me yet, but it has an infusion tip that you can use with it. So you could potentially do an RF microneedling and then do simultaneously, or part of the treatment, you could do an infusion of Sculptra with that, which I think would be phenomenal. So I'm looking to maybe demo that soon-ish, although that's been around for a little bit.
Yeah, we've demoed it once. We love it. We don't have it yet. We haven't pulled the trigger quite yet, but it's a good one. We like to make sure of what's all out there as well.
Yeah, sorry, I was going to say one of the advantages also of finding a really geeky provider who has a lot of knowledge is that we really are research junkies, and like we have to demo every single device, ask every expert we know, what's your experience with this device? What are results with it looking like? And, pick the best one. So, at my clinic, we always have the best in class. So when some new amazing thing comes along, it's like, ooh, we have to figure out, do we need to change this up, up our game? And we're constantly doing that.
We're on the same path. So I refuse to bring in allotherapy, and I research so heavily, and I never will jump on the bandwagon just because everyone else is doing it. I actually like to be unique, but I specifically will demo for a long period of time, everything out there. And I'll travel and I'll train with doctors and get the real true feedback, and they're not making a commission. They're giving me true sound advice, but I can see and feel the benefit, and especially with the price points. And, I like to get feedback from patients too, and they're going other places prior to coming. I'll ask for their experience, and they'll see our treatment, the results, and they'll compare. They'll say, wow, this is outstanding, far better results. It's lasting longer and it's less expensive. And that's when you're on the right track, but it's just really sad. There's so many bells and whistles you have to see through.
Yeah.
And I see a lot of excessive marketing. And sometimes I've seen like golf pros advertising for this machine that's for fat slimming, and they don't have an ounce of fat on their body, and they're over in Europe advertising that. And there's just a high amount of marketing you see.
Yeah. And some of these companies do a lot of direct to consumer marketing. And so then it's hard to know, right? As a consumer, like what's worth it, what's safe. And that's why it's really helpful to have someone like us, right? Just telling you, oh yeah, this is the deal on that, right? Because a lot of people, you'd be amazed. Like these companies are big because people fall for their sales tactics and buy the machine. And once you own a machine that's $150,000, $200,000, $250,000, you have to sell it. You have to sell that to patients, whether it's good or not, whether you get good results. Why? Because you're in the hole for $250,000. You got to do something with that machine. And that's the kind of pressure that people are under. I once met a doctor from California who, she was an internal medicine doctor, took care of patients like regular, primary care. And she was interested in starting in aesthetics. She had never done anything in aesthetics. And a Cynosure rep got a hold of her and talked her into a package of 7 lasers, I think. She spent several $1 million. She had no idea what she was doing. She didn't know how to provide these services yet. And so she was in the hole, like really, really stressed about trying to sell this to people when she really didn't know what she was doing. And that's, that's also on her. Like she bought the devices, but like, that's the sales tactics are, you need this, you need that. It's a Medspa in a box here, sign on the bottom line. And then they walk away, and they leave you with, and so there are a lot of unscrupulous people who, or maybe they were duped into buying the machine, but now they've got to dupe other people into having the procedures, or, they won't be able to meet their debt payments. So
I've heard plastic surgeons like similar, in our Midwestern area, that's just happened to them as well. And they don't necessarily have maybe the time to do a lot of the research, and they have maybe an esthetician or a PA working under them. And so they'll buy the equipment and just say, hey, go ahead and take care of this for me. And it's really unfortunate. I think some of them, I've also heard adverse reactions with some bad equipment out there, and they're stuck with these machines. And that's the last thing that you and I want to deal with is we want to make sure it's stellar results.
Yes.
We would never bring in a piece of equipment that's going to give bad results. Or
from our point of view, right? Like we want all happy patients walking out, telling their friends, telling how much they like it. Right. One bad outcome just
Exactly.
ruins everything, right? We don't want to take that risk, and we don't want patients to experience that, bad outcome. So, we are taking the time to do all that research. I assume like your audience here are mostly consumers, right? Like
Right.
really important to go to somebody who knows what the heck they're talking about, and they've done that
Exactly.
research. And
I feel like the patients know when they come in to see us, you'll notice like they're commending us because they may have been elsewhere too, but they
Yep.
can just tell, wow, I can tell you really understand what you're doing, and you
Yeah.
really like to educate and explain why we're doing this and just the
Exactly.
benefits and what the expected results will be. And that's a whole different scenario from someone who's just coming in blindly and isn't really sure what they're going to get, and no one's really talking to them about their experience or what to look for as far as the results.
And I talk people out of things too. They come in saying, I think I want X. And it's like, well, that wouldn't be the thing I would pick for you. So here's why. And here's what and when you explain stuff, then people are really, they're so grateful, right? Like, oh,
are.
well, I guess you're not just trying to sell me something because you just talked me out of that. So, all
Right,
well,
I do the same. They're like, wait, you don't want to take all my money today? No, well, you're going to start baby step approach.
Yeah.
Let's get your skin ready. We don't just dive into some of those treatments, right, from the get-go.
Yeah,
And
exactly.
we should talk a little bit about someone who's never done Botox or other neurotoxin. For someone out there who's maybe considering it, what are some things that we can help them with just feeling more comfortable? And, it's a good place to start. We like to, again, address that as more of like a baby step approach, not over injecting anyone when they come in.
Yeah. Well, so basically there are certain lines in your face that really the only thing that are going to tackle those is a neurotoxin like Botox or Dysport, right? So the big three are the 11s, so the two vertical lines between your eyebrows, the forehead lines, and then the crow's feet at the corner of your eyes. There are a bunch of other things that we can treat too, but those are the big three. The other ones that are really easy, the bunny lines, not everybody has them, but those little bunny lines that are up on the top of your nose. As you get older, you make this, everybody has a subset of facial expressions they make all the time. Some people do the frowny thing. That's me. I like just chatting,
Or
thinking,
focusing.
pondering, focusing. I get that, and it makes you look kind of mean and angry. But other people have, the forehead lines, crow's feet, or all three. And over time, the more you make that face, the deeper they become and the more etched in your skin they become. So when you're a kid, you can make those lines, but your skin bounces back. And so those are called dynamic lines, right? But as you get older, they over time become etched in your skin. And once they're etched in your skin, those are called static lines because they're there all the time. So once the line is etched in your skin, you can't 100% get rid of that line with Botox or Dysport or any of the other neurotoxins. But to the extent that it's there from arresting tension in the muscle, when you relax that, it flattens out quite a bit. So even if you have permanent lines already, it's still okay to do. It still works really well, and they flatten out a lot. But that is why a lot of people talk about prevention in the sense that they're doing it when the lines are still static. They haven't become fully etched in your skin yet. Because if you do Botox or Dysport when they're still dynamic lines, then you can prevent them from becoming static. So people ask about like, what's a minimum age? Or is it, I'm 25, is that too young? Or I'm 39, is that too young? It's like, well, no, it's not too young. I mean, nobody needs Botox,
Right.
okay? Nobody needs it. So it's optional at any age. But I really have found that most people, once you do it, it's like, oh man, I kind of should have done that a while ago, right? Because not only does it look better and you kind of look in the mirror and you're like, wow, I like that. But also, if you ever have headaches tend to go away because headaches usually start as tension in the muscles. And so like, I'm not a big headache person, but when I do get one, I know that it's time to get injected. Like, I probably
Right.
waited too long. And it really helps for migraines, obviously, but even if you don't get migraines. And so anyway, and it's totally temporary. So you do it, it lasts, 3 months if you're getting Botox, 4, maybe a little more if you're getting Dysport. And then you don't have to do it again, but I do find that most people really want to do it again.
What I like is it softens. We like to just soften and enhance their look and what they already have. to
Yeah.
a point where someone will notice them and say, gosh, you look so good. I can't figure it out. Can't put my finger on it. And that's what we want, right? There's the superficial look too that we avoid at all costs. It's just not something that we like to focus on over treating patients. And I think there's a little bit of a complex, at least in our area, in California, obviously some areas a little more than others, but just having that natural softened look. So we're not so harsh looking.
Yeah. I find that, well, in the Pacific Northwest where I am, people really want to look natural. People do not want to look like they've had anything done. And you can totally do that with Botox or Dysport or any of the other ones. You can just do a very natural looking thing. I think actually when people look overdone, it's more often from filler than from Botox.
We're fortunate to work with a great new line of filler. Revance makes the RHA, and it's from Switzerland, the same woman who invented the Juvederm. She invented that new line of fillers, and it has the most hyaluronic acids, with our skin is made of that, and then the least amount of chemical, and it's really undetectable. And that's become our new portfolio, and it's wonderful because, you really couldn't tell we're injecting into the face, and that was not the case years ago. You don't have the bumps or lumps or nodules or any issues.
And I like the Galderma flexible fillers. So Juvederm I don't love. It tends to be more lumpy, and the older Restylane also tends to be more lumpy. But I do like Restylane. There's a whole series of flexible ones where it's kind of like a Gumby doll. Like it holds its shape, it rests, but when it moves, it flexes, and that's kind of more like natural skin. So I do like those.
But similar to what you're describing, but it's just important to have it naturally move with our own dynamics of our face, right? And just
For sure. But that's also why I like Sculptra so much, right?
Me too.
It's so natural looking. It doesn't make your skin stiff. It doesn't have that stiff look. People with too much filler, their just face doesn't move, and it does not look normal.
I think it's important for us to describe maybe to someone who's new to this that we do combine. The Sculptra is important to stimulate that collagen, and then the filler may be needed, right, to soften some of those nasolabial lines, lifting in the cheeks, which Sculptra does a little bit of, but it's important to accurately prescribe and administer what's needed, and it can change, over time as well.
I mean, it's important to have all that catered to you and what your skin and your face looks like, as opposed to, everybody gets, the same treatment when they walk in this door. I think a lot of places are focused on injectables only, mostly neurotoxin and filler. And so a lot of places, that's their only tool. And so the whole hammer and nail scenario, it's like everything's a nail, everybody gets a hammer. And I don't think that is helpful. I think that's one of the reasons why the industry is a little bit in trouble. One of the things we talked about earlier before we started recording was about the fake product. I think that we should mention that because
let's address that.
There's real Botox, Dysport, and RHA fillers and Restylane, refined. We obviously buy the real stuff in our clinics, right? But you can order fake product off the internet, and not only could it be just fake or something that's not approved in this country, it can also be just completely subbed out for some other material, or it could be tainted with bacteria. So really, really important to ask those questions as well. But I can guarantee you, if they have real credentials and they have a real medical director and they're answering your questions, almost certainly they're getting legal, real product. But you can ask, so you're getting that real Botox from Allergan,
it's
right?
amazing if you get that question. It's like, why would we would never even consider that. That's a non-negotiable. We would never want to put anyone at risk.
As a physician, it's first, do no harm. I would never inject something that I didn't know where it came from into a human, right?
There's just no way.
Oh my gosh. So yeah, I think that's why I wrote the book. I'm sort of hoping people are really interested in this, because I really feel like this is such a huge industry and there are so many people participating in it, just kind of trusting in the system that, everything's legit. You walk in and everything, it looks nice and people are wearing scrubs and you think, this must be regulated in some way. There really is no regulation of the med spa industry. The way hospitals get inspected, nobody's walking into med spas and inspecting them. As a matter of fact, in the now over 10 years I've been open, we actually have to have a special cosmetology license to do facials in my spa.
We do too.
And so we've been inspected a couple of times by the cosmetology board, and they care about that, like our garbage cans have lids on them, right?
Sanitation.
But the next room over with the lasers that like could blind somebody or
Right.
the injectables that could blind, nobody's inspecting that. I mean, I care because it's my license on the line, but
Like you said, it only takes one case. We don't want that any kind of case,
oh my
anything to happen.
gosh. So I don't want to take away from all the great things we do. It's really cool, but I really think it's important people like do their research and make sure they're going to a really smart provider who's done their research as well.
Yeah, I agree. Well, I would love to ask you too, like in the last 5 years, is there a new belief or habit or behavior that's improved your overall well-being or life in general, or how you work in your practice every day?
Well, that's such an interesting question. I mean, my most recent, for me, I've always been active. I've always worked out. I, lift twice a week. Once I hit 50, I had trouble losing weight. I just couldn't maintain it anymore. I was slowly getting bigger. And so for me, recently, I did a few months of tirzepatide and I lost like 20 pounds and I feel better than I've ever felt. I've always had a great diet. I've always been active, but being able to lose the extra 20 that I had gained in my 50s, it's just been life altering for me. And I don't have diabetes. I'm not obese. I'm very fit, but just found that in my 50s, I couldn't do what I used to do when I was younger and have that make a difference in my body. So, I can do pull-ups now. It's like pretty, I have so much more stamina. So I have to say, like, I really think those drugs are really helping people. I don't know where it's going right now because the FDA took both commercially available GLP-1s off the shortage list, which means that compounding pharmacies can't legally do it anymore. Not sure what is going to be the outcome of that because I think there will be a massive shortage in a few weeks when those deadlines happen. But I do think those are great drugs, and I don't think they're going anywhere. I think that, one way or another, they'll still be available. They'll just maybe potentially be more expensive.
It's definitely a hot topic right now, and so many people are also doing the same thing. I'm not myself, but I think it's definitely going to be interesting to see where it goes, right? And in the next few weeks,
I was so skeptical when it was just Ozempic and semaglutide, and there's a lot of side effects with those, and so I just was like, I don't really want to do this. Either for myself or for patients. I just didn't get into it. But once tirzepatide came out, I was like, because there are very few side effects with that and really, very significant weight loss. And so we started a program in our clinic last year, and it's just been phenomenal. And I really do think it's a game changer for, health in America, assuming we maintain access for people. So
right, I agree.
And I did a recent podcast on my podcast, Medspa Mayhem. I talked to my best friend. We both tried it separately, and we just kind of talked about our experience. But I think those are pretty cool.
What advice would you give to someone that's new, getting started in our industry? Anything that they should
professional?
ignore?
That's interesting. I think the most important thing is getting as much education and training as possible. I think that knowing if you're going to be an injector, so if you're a medical person, either an RN or a PA or a nurse practitioner or a doctor, and you're really interested in injecting, you need to know your facial anatomy inside and out. It's really complicated. And, it's very variable too. One person, their arteries might be going a little bit different place than somebody else. So becoming an expert in that, it's not as simple as looking at somebody's face and thinking, oh, you need a little volume here and you need a little volume there. You really have to know your anatomy. And I don't think that is very common. I don't think that most injectors really do. So that's number one. And then everything else, I would say, if you're going to buy a device or, think about offering some kind of treatment, you have to look at every single device or way of doing it and ask at least 3 people who are actually providing that treatment who do not work for the company Okay.
Correct.
What's their experience, the good, the bad? What are the complications? What's your complication rate? Are patients happy? Do you ever have to give someone a refund because they think it didn't do anything? And look at all the consumables and everything and figure out what makes sense. Do not ever believe a single thing a rep ever says.
I
I'm going to say it
100%
again.
agree with
Never
you.
believe a single thing a rep says. The rep does not know. They are lying. They will not tell you anything having to do with medical or physiology or what's going to help your patients. So just don't believe it, regardless of what they tell you, or even if they tell you this deal's only good until, whatever, my deadline of this, or this is a demo machine. And it's always a lie. Don't believe it. And so do all your research, take your time. You will be really happy you did. Because, once you've done all that research and you really know that the thing that you're offering is worthwhile, it gives you good results, it's not, overly expensive, the company is good to deal with, you will be really happy. And then your patients will be happy. And of course, for anybody listening who is a, potential patient or client, you want to make sure you go to that person who did all that research.
You do.
That it's just so important. And I just can't tell you how many people I've met in the industry over the years who, they bought some terrible device that was bad for one reason or another. And if they have scruples, if they are ethical, then it becomes kind of a very expensive coat rack, $100,000 coat rack in their office, because it's not worth using, right? But if they're not particularly ethical, or if they're under some financial stress or whatever, they're going to be using that device even though they know it's not good.
It's really tough to hear. And it's like when you're talking about the facial anatomy, I can't imagine. We don't know a lot of injectors that don't do a lot of that training. And it's so important to know each and every part of it. And we avoid so many pitfalls, like you said, with the equipment. And, you really have to see through a lot of the sales techniques and all of the things that are coming at us, right? There's a lot out there, and it's just so important to do the right thing. Always do the right thing.
Always do the right thing. Absolutely.
And you won't fail. And I want to ask you, my final question would be, what would you say is one of the best investments that you've made for yourself?
For myself? Oh, for sure, Genius and Lathe. So that's RF microneedling combined with laser resurfacing. So I did that. The year I turned 50, I did 5 of them, because we generally say 1 per decade, right? And then I've done that every 6 months since then. And I really credit that with having good skin. I mean, I take really good care of my skin with skincare at home, but that's the main thing is doing that. And I think that is huge, because that builds collagen and, it thickens and tightens your skin and makes your skin look amazing. So
I think that's a great advice for someone, because each decade gets worse and worse. And I'm older than you think. But I will say, doing that versus threads even is a better investment, don't you think, overall?
Oh, much better. Yeah. I'm not a big thread fan either because of the complication rate, but yeah.
And I've heard some of the most elite plastic surgeons say, if you are, and I'm not one to go into the knife, but if you are considering a future facelift, you want to avoid threads.
Yes,
because there's scar tissue and things like that. And so doing the RF microneedling and the treatments, the Genius, those are definitely safe.
And those actually make your skin healthier. So when you go and sew the skin, as you get older, it gets thinner and thinner. I don't know if you remember what Joan Rivers looked like as she got older, but her skin was like paper thin. You could kind of see through it, even on television, right? Mm-hmm. So if you're trying to sew thinned out skin, it's much more friable, much harder to sew. Whereas if you are sewing really healthy skin, it goes much better. The healing is much better. So, and actually doing microneedling, radiofrequency microneedling, and laser resurfacing, that makes your skin healthier and easier to sew. So it's actually, not just safe, but beneficial.
It is. It's great. Well, I really appreciate you taking the time today. It's been a pleasure having you as a guest speaker.
It's been great talking with you. Thanks so much for having me on.
Hopefully we've helped some of our listeners gain some insight. So thank you for that and being vulnerable and honest. I appreciate that.
You're very welcome. It's been great chatting with you.
Until next time. I hope you found Dr. D very insightful, and we were able to answer some of those hard questions if you're new to the med spa industry. We are here to support you every step of the way. Be sure to subscribe on your favorite podcast platform to hear all future episodes. Thank you for being a part of our community and for tuning in today.